These are the warning signs a mum-to-be is having a problematic pregnancy. If you're experiencing any of these while pregnant, seek medical advice. No two pregnancies are exactly the same. While delightful symptoms such as nausea, frequent urination and fatigue are considered common, it's not to say every mum-to-be will necessarily experience them all. That said, there are some indications that a pregnancy is perhaps not progressing as it should be. These signs, compiled by Mamamia, may not be anything serious, but are worth knowing and seeking medical advice on. What to watch out for when pregnant. 1. You're experiencing swelling. Every mum-to-be can obviously expect there to be some swelling and puffiness. Medical professionals, however, warn expectant women to keep a close eye on their face and hands in particular. This is because swelling in these areas could be a sign of preeclampsia or toxemia. The same applies to puffy ankles and feet. If you feel the swelling has come on suddenly, then talk to your doctor, as an early diagnosis is crucial with preeclampsia. 2. Your baby is moving less. You should start to feel your baby move between 16 and 24 weeks. It's at the 24-week mark that you will likely notice these movements get increasingly stronger, though you can expect your baby to be calmer at night. If you realize these movements are getting noticeably less, Charity Kicks Count offers this advice. Call your midwife or maternity unit. Do not consume large quantities of something to prompt your baby to kick, as this may give indigestion or gurgles you may mistake for movements and give false reassurance. If you're unsure if your baby's movements have slowed down, take some time to focus on movements. Do not use any handheld monitors, Dopplers, or phone apps to check your baby's heartbeat. Even if you detect a heartbeat, this does not mean your baby is well. 3. You're bleeding or spotting. Even if not pregnant, this remains something to watch out for. Some light bleeding is normal during pregnancy. In fact, one early indication you are pregnant is something called the breakthrough bleed. A woman may pass clots or blood with a more stringy consistency, or it may just be spotting. It's important to bear in mind, however, that bleeding can be sign of miscarriage, placenta previa or placental abruption. Should you notice any blood, contact your obstetrician or midwife immediately. 4. You're experiencing pain. As with swelling and spotting, pain is unfortunately one of those things which can happen during pregnancy. Should the pain be constant, severe or comes with bloody or any other symptoms, contact your doctor to ensure to rule out miscarriage, ectopic pregnancy or cysts causing your pelvic, abdominal pain. 5. You run a fever. Fever isn't uncommon during pregnancy. In fact, the NHS explains due to a compromised immune system, a mum-to-be is at greater risk from flu. However, if it lasts longer than 24 to 36 hours, see your doctor. If pain also accompanies a temperature, you should visit your doctor, as there's a chance it could be an indication of a kidney infection, listeria or pneumonia.